Welcome back to Balanced Health. Dr. Morris Papernick and Jane Barber are here again with us to talk about CFS, chronic fatigue syndrome, and answer some of the questions that you sent to balancedhealth@tln.com. And welcome both of you. And when we went to the break, Jane, you were actually telling us about that you had you thought it was titanium screws in your neck, but it ended up being nickel. And how did you think that was connected with your problem?
Well, ultimately, when I finally got into the hands of a specialist, a very competent, compassionate doctor who specializes in treating patients with CFS and related illnesses, he put me through, we organized a battery of tests, and I went and I had a test, and the nutritionist that was working with the allergist, when he went through my diet, he just said, I don't understand this. He says, you take such good care of yourself. He says, I've never seen anybody who takes such good care of themselves, eats so well, and is so sick.
Wow.
Let's run this test. So we run this test, and in the meantime, I had to have an MRI as well, so I had to know what the metal was in my jaw.
Sure.
So I'm calling the surgeon and saying, please fax over in writing what's in my jaw exactly, because I'm going for an MRI.
Yeah.
And so he did that, and I remember reading the fax going, well, this isn't titanium, this is something else, because I'd formerly been in pharmaceutical advertising, so I knew an alloy. I knew a brand name when I saw one. So that kind of made me stop and think. So 4 days later, we get back the blood test results. We very carefully go through them, and this nickel chloride 2 comes up. And he says, well, where would you have been exposed to nickel chloride 2? I said, I don't know, let's read the list. And I look at the list, and it says the name of this metal alloy, which had been the standard of practice for 35 years. The surgeon couldn't have possibly known.
Right.
They didn't find out till 95 that there was any problem with it. I had my surgery in 90. So it's nobody's fault. It was just the luck of the draw. So I think we sat there for 10 minutes just stunned. He said, this has been tearing down your immune system for 10 years. And when I went to see a maxillofacial surgeon to see about being removed, he said, too late on the diagnosis because it's so integrated with the bone that it's too risky to have the surgery to remove it. So
it's just something you have to live with.
Well, yeah, and you know, it's a lot of people in life have things they have to live with. You know, I got to live with red hair too, so
Oh, no, you don't. I beg to differ.
You have to live without here. How about that?
There you go.
There you go.
You bested me on that one. You bested me on that one. So for me, managing the symptoms and managing the decline currently today is the goal.
Does it tend to relapse and come and go? Do you tend to have periods of good times and bad times, or is it consistent?
Very much so. I fall into that push-crash cycle, and I'm just now coming out of a rather lengthy relapse.
Okay.
Any common denominators, Jane, in those relapses? Time of year, foods eaten, stressful times in your life? Any common denominators at all?
I would say the common denominator is physically or mentally pushing myself too hard, trying to catch up from the things I couldn't get done when I was down from the last relapse.
The vicious cycle, isn't it?
Yeah.
Doctor, she said she just has to treat the symptoms and kind of have to live with it. Do you cure people? I know Joe has been cured. How often do you see a cure, or is it something that you just have to treat the symptoms?
Well, we never promise any of our patients a cure because that's almost like a false hope. So the best I tell my patients is we're going to try and get to at least 80% of where you were before. The treatment, however, is not really aimed at a cure because you don't know exactly what's causing this. In your case, there was this metal alloy that's possibly causing this, and that could possibly be something that needs to be, if it were able to be treated with surgery, that would be the thing to do. Unfortunately, like with you, most patients with CFS are treated symptomatically. We treat the symptoms and try to improve the quality of life, even though we can't give them a cure per se. But there are people who do get better. And one of the questions that people ask me is, well, if I don't take any medication, will I get better? And the answer is, probably, but I don't know how long it'll take.
What kind of medications would you often have your patients on for this?
Well, the treatment is aimed at the common denominators with these patients. And one is they have non-refreshing sleep, so we try to improve sleep. And that can be done by either giving sleep aids or giving antidepressants which have a sedative effect as a side effect. using medications in the daytime that'll improve their energy, it'll improve their cognitive functioning, memory, concentration, things like that. Again, those can be either stimulants or those can be antidepressants as well. Sometimes we use thyroid as an addition to that to improve upon that. So there are multiple cocktails, so to speak.
And most of those are pharmaceutical based. Jen, have you ever tried, or Dr. Papanek in your practice, any type of homeopathic applications that remove metals from the blood, or at least propose to remove metals from the blood?
Yes, I did that for the first 10 years when I was being treated by an alternative therapy doctor before I knew I had CFIDs and before there was a specialist that I could access. And the irony of it is, even before I got sick, I was a big proponent of alternative health. I routinely did massage, acupuncture. I went down to Chinatown and did Chinese herbs and supplements and knew which supplements to take with other things. And so the frustration, I think, for the physicians in my case has been, if you just didn't have this thing that was so toxic, that was constantly, causing a problem, and had you been diagnosed early, you might have been able to get back on your feet earlier. I'm still hopeful. I think that's part of the key to managing symptoms, is to never lose hope, because tomorrow they could find something new.
Absolutely.
That happens every day in medicine, in other illnesses. And I think there's some new modalities, treatment modalities, and I have to really say that the research that is done by the Centers for Disease Control and other people, by the Dr. Leonard and his group at DePaul, and the support that the CFIDS Association of America is getting, is really starting to put some
results.
Get some results.
It's
starting to get some results. I really feel like we're at a point where we could turn this, as I say, we could crank the wheel real hard one way and not hit the iceberg.
Well, that's really encouraging, and I certainly hope for you and for the millions others that really have this.
I hope so. I would hate to
see
see anyone ever go through what I went through in having, well, from, let's see, 1990 when I first got sick, 92, it disables me in my own occupation, to not really knowing what I had until 2000.
Yeah, that's worse, isn't it, Jane?
Time.
That's the worst part of it.
Wow.
Well, thank you both so much. Yes.
Hopefully by you coming on today, to get, the awareness alone will help get people to the doctor earlier and get diagnosed earlier. Well, I hope this has been beneficial for you. I'd like to thank Dr. Morris Papanek and Jane Barber for joining us today. For more information on our guests and on chronic fatigue syndrome, visit us at tln.com, click shows, and then click Balanced Health. If you would like a copy of today's show, call 888-242-9393. Now, we'll be right back with your healthy habit of the day. Don't go away.